Hello, everyone. My name is Donaldson Conserve. I'm an associate professor at the George Washington University in the School of Public Health, and I'm also the founder of the Black Male Professors and Researchers Collective. And today we are conducting another interview with Dr. Muktar Aliyu as part of our Black Male Professors and Researchers series. And I have the pleasure of having two co-interviewers who will go ahead and introduce themselves. And if you have not subscribed to our YouTube channel, please go ahead and subscribe now so you can continue to receive very inspiring interviews like this one. So Dr. Zaki, please introduce yourself.
Thank you, Professor. I feel privileged to be here. My name is Dr. Zaki. I'm from East Africa, Ethiopia. I'm a doctor by trade. I got my medical degree at Addis Ababa University, and you worked as a clinical practitioner for a while before joining the government at the Ministry of Health level, and worked at health system strengthening, policy making and advocating before joining the non-governmental aspect and specifically working on digital health systems, which is my passion. I currently am an activity manager. I'm responsible for development, implementation, scale up of these health systems, and particularly on how they impact health outcomes and how we can use evidence-based decision making to maximize their benefits. So I'm currently also an Atlantic Fellow for Health Equity Fellow at this 2024 cohort, and it feels nice to be here and have an interview with you guys. So thank you.
Thank you very much. Dr. Ekerin, please introduce yourself.
Yeah, thank you. My name is Dr. Olabode Ekerin. I am a medical doctor by training, and I work with the State AIDS and STI Control Program. It's a unit under the Department of Public Health at the Kaduna State Ministry of Health. I am also pursuing my master's program in population and reproductive health at the School of Public Health, University of Port Harcourt, Nigeria. And basically at the State AIDS and STI Control Program, I provide technical support for the HIV program in the state and basically mentoring healthcare workers on better service delivery for the HIV program and persons living with HIV in Kaduna State. Thank you. And it's nice.
Thank you, Dr. Ekerin. Now our guest for this interview, Dr. Muktar Aliyu, please introduce yourself.
Hello, thank you, Dr. Conserve. Muktar Aliyu. I'm a professor of health policy and medicine at the Vanderbilt University School of Medicine, and I direct the Vanderbilt Institute of Global Health here in Nashville, Tennessee.
Thank you very much. Well, I will go ahead and start by asking you, how did you become interested in global health? You're the director of the Vanderbilt Institute of Global Health. Maybe you can tell us how you started becoming interested in this field.
Well, global health was a natural for me. I'm originally from Nigeria. I went to medical school there. I came to the US more than 20 years ago, 23 years ago, pretty much to do a master's in public health. I've always been interested in public health. And I did the MPH program at where you are sitting right now, the George Washington University.
Oh.
Yes, and then from there, I went on to do a doctorate in public health. And then I met my mentors there at the University of Alabama, Birmingham, Dr. Pauline Jolly, Stan Vermont, Hamis Usalihu. So people who are very much involved in global health. And pretty much that was where my passion got strengthened. Yes, and so from there, I came back to Meharry Medical College, did my residency, and did a fellowship up at Mayo Clinic. And then in 2008, Stan Vermont, who at that time was the founding director of the Vanderbilt Institute for Global Health, asked me if I could help them pull together a grant, a CDC grant that was targeting providing comprehensive HIV services to people with HIV in Nigeria. So that was how I got involved in 2008. I was just about to start my fellowship at Mayo Clinic. So I left for Mayo, and then I came back to Vanderbilt, joined Vanderbilt a year later in 2009. And I've been here since then, 15 years.
Wow.
Yeah.
Wow, thank you for the summary of what I'm sure was a very long journey to get to where you are. But I didn't know you also know Dr. Pauline Jolly. She's a colleague of mine, and it's been a joy recruiting undergraduate students through her Minority Health International Research
Yeah, the
Training
merch.
Program. Yes, the
Yes,
MERT program.
our
So
program. Yes,
wonderful, wonderful. All right.
yes,
So I'll just ask one more question regarding the transition. You mentioned you went to get a doctorate of public health, which is different from the PhD. If I'm hearing you
yes,
correctly.
yes.
And I'm curious to know what led you to the decision to pursue a DRPH instead of a PhD.
Yeah, so what happened really was I was at George Washington doing the master's in public health, and I had visited Birmingham. I had visited my sister, who at that time lived in Birmingham, Alabama, and I realized that UAB had a strong public health program, and I wanted to transfer my MPH program from George Washington, which, as you know, is a very expensive program, uh, to University of Alabama at Birmingham. But it was too late. But then I had already applied and paid the fees. So they said, well, you know what? If you want to, we can keep this application and we can consider you for a doctorate program next year, if that's okay with you. So I pretty much, they moved it from a master's application to a doctorate application. And that was how it happened. I finished the MPH, and then pretty much they had given me admission at the time, and it was just really a case of making the decision whether to go ahead and do the DRPH or not. I never applied to a PhD program in the first place. The DRPH programs tend to be more, they're considered more professional programs, really professional public health programs. If you're planning to practice in public health and not really intending to pursue a research academic career, a DRPH is probably more appropriate. Now, the major disadvantage is that unlike the PhD, it's not as well known. So it's a pretty well established program, at least in the US and in the UK. But in other parts of the world, it's not as well known. So people will keep asking you, is this a doctor of pharmacy? Is it a doctor of pharmacology? Is it physiology? What does the PH stand for? So but it was a good, excellent program. And I think it was really worthwhile. And essentially in the US, really a doctorate is a doctorate, right? It all depends on what you want to do with it. It depends on your background and your profile, the entire profile, not really the degree, the isolated degree itself. So yeah, you make the most of what it is. So I consider the PhD and the DRPH, especially things like PhD in public health or PhD in epidemiology, to be just as pretty much almost the same thing.
Thank you, thank you. Yes, a lot of people don't know about the DRPH, and I actually plan to start a series just on DRPH, so that people can learn more about it and know it as an option, because I think a lot of people know more about the PhD. But one of the differences, I guess, difference I can think of is that, and you can correct me if I'm wrong, is that a lot of the PhD programs provide funding for the student to come and do a PhD, whereas the DRPH programs, or the ones that I know of, students have to pay, or unless they have a sponsor from, who's going to support them. Is that your also understanding, or is that not the case?
I think it depends on the institution.
Okay.
It really does. Now, if it's a DRPH that is part-time, obviously you're not going to get funded for it. The DRPH I did at UAB, it was a full ride. It was a full ride, 4-year scholarship.
Okay.
Yeah, it was a full ride, and I'm eternally grateful to UAB for that opportunity. I did not pay a dime for that program. So I think it really entirely depends on the institution. There are a lot of DRPH programs that are online, some of them that are part-time. So I think for programs like that, naturally they will not be fully funded. And then on the other side, there are PhD programs that are actually not funded.
Okay.
On the other side, I know PhD epidemiology programs that the first thing they would do is to look for a faculty sponsor, someone who has a grant. to take on the student, but they will not have internal funds to support the PhD itself.
Okay. I'll ask one last question before switching to our co-interviewers. Since we are talking about PhD programs and Vanderbilt University Medical Center or the Institute of Medicine and Public Health offers PhD programs, are you able to share a little bit about the PhD programs at Vanderbilt that you know of, and funding and recruitment process?
So just for clarification purposes, I'm not the program director for either for those programs. I co-direct the MPH, the Masters in Public Health Epidemiology track. Okay. So at Vanderbilt, we have the Masters in Public Health that has 3 tracks: epidemiology, health policy, and global health. There are 3 tracks there. So I co-direct the epidemiology track. And then the global health track is partly under our institute as well. We provide our faculty at BIGH at the Institute for Global Health pretty much lead that program. And then there are the PhD programs, the PhD in epidemiology program, which is led by Dr. Peter Ribeiro. It's a really strong program, highly quantitative, and we've had outstanding graduates from that program. Then there's a PhD program in health policy that is led by Stacy Doucette-Zina. It's a relatively newer program, but it's really taken off. We started having the first graduates, I believe, 2 or 3 years ago. It's really taken off, and it's most of the emphasis for that program is on domestic health policy issues. Okay. We get a lot of students applying to that program from outside the country, from abroad, which is nice, but the emphasis really for most of the faculty that work in health policy with us, most of their work tends to be domestic focused health policy issues. And then we have the PhD program in biostatistics, which is under the Department of Biostatistics, well-established, long-standing program. And I think those are the PhD programs that we have. We have EPI, health policy, biostatistics, and then we have the MPH, the 3 tracks in the MPH program.
Thank you very much. So I hope anyone who's listening, can look into those programs and learn more about them. Now I'd like to pass it over to Dr. Ekerin. I know you and I, we've had some discussions about masters and your interest in PhD, but also as a medical doctor who's interested in research and doing amazing work. So I'm sure you have some questions for Dr. Aliyu.
Yes, thank you for that. I'm quite curious whenever I find medical doctors in public health. And something that comes to mind is and I would want to ask you is, I went through your CV really before now, and I realized that after your medical program, after your NYSC, you started a residency program at Bayero University in public health. So and we know the way it is in Nigeria, you naturally expect, you finish in medical school, you tend to be a clinician, go for internal medicine and the likes. It's really uncommon to see people do public health. And it appears like you have it all defined from the beginning. So I would want to ask you, at what point did you have all of this defined that, oh, I am going for public health? And how did you get to that point? Because really, medical school, I don't think medical school is structured for you to really fall in love with public health in the real sense, because you go through a lot of clinical classes and all of that. So I would really want to know, at what point did you get it defined? At what point did you come to that conclusion that I am meant for public health? Thank you.
So thank you, Dr. Ekerin. So I think I would probably not completely agree with the perception that a lot of physicians do not go into public health. So we've had the West African College of Physicians, the public health component of that. And we have the National Postgraduate FMCPH, the College of Public Health, the National College, under the National College. Those are both established residency programs in Nigeria that provide training that's specific to public health. They might call it community health under West African College, but then it's public health and national college. And I've had people who are my seniors by many years who went through those training programs, Kabiru Sabitu, and so on. So those programs, Clara JB, those are just examples of people who have done fellowships, Ayuba Zwaka, who have done fellowships in Nigeria in public health, and they are practicing public health people, Isa Abokar and so on. So what happened was when I went to medical school, I went to med school in Nigeria in Zaria, and when I graduated, I had the graduating prize for the best student in community medicine, which is the same as public health, essentially. And I graduated in the same set with my twin brother, Sani. And so when it came to deciding on what residency program that we were going to go into, we had no intention of not doing residency. We had every intention to go into residency training. So Sani wanted to do internal medicine. And I did not want to do the same residency program with him. So that was one of the reasons I went into public health. I didn't want to do the same residency program. And then the other thing too was that I had done so well in medical school in public health. I just developed a love and a passion for that specialty. So yeah, so public health is, there are a lot of physicians nowadays who either go into residency training in public health, or they do the master's in public health initially, and then they go back and they do residency training. But it's an established specialty, pretty well established specialty. The only difference being that we probably are not as prominent as the surgeons and the internists. But it's an established postgraduate training program, at least in Nigeria, I can say that.
Okay, thank you, Dr. Ekerin. Dr. Zaki.
Okay, thanks, Professor. So I'm kind of curious, and just sort of a general question I want to ask Dr. Aliyu. So you've chosen the health sector as your, baby, and started working on. It's a long story, as you've told us. You went from a clinical to an academician to a research person. And I feel like you've had an impact on the health sector as well. But personally, I mean, I want to ask you, do you feel like you've made an impact on the health sector? Do you regret joining the health sector? I mean, there are so many other sectors that are easier to, prove an impact in, and become shine in those sectors. Health sectors are very difficult and politically, socioeconomically tied sector, which is pretty difficult to make an impact on. And do you regret, joining the health sector? What do you have to say to people like us, young doctors, research minds, who have sort of a tough time, showing impact on the work they're doing, and how to, motivate themselves to become more strategic and impactful. Yeah.
So thank you, Dr. Zaki. So yeah, so my answer to the first question, absolutely no regrets. I'll do this all over again if I had the opportunity to. I might do some things a little bit different, but absolutely no regrets. People who go into the healthcare system, we go into health care not because of the income or some personal gain, but really because we want to help others, right? We want to impact other people's lives. In medicine, you are impacting patients' lives one patient at a time. With public health, you are actually impacting the community as a whole, and hopefully making a much bigger impact there. So yeah, so I think absolutely no regrets, absolutely no regrets. And I would encourage people to, they say go for your passion, right? But really build yourself up initially. Decide on what it is that you're good at. Think about what you're good at, and then continue to learn to improve yourself and to apply yourself to those goals. Have set goals, network widely, develop relationships with people who can mentor you and help get you onto the right track, help you become successful. I do believe we've made an impact. We continue to make an impact. Right now, at the Vanderbilt Institute for Global Health, we have programs in some 26 countries. We have 140 plus staff and faculty. We have over $100 million in annual grant funding. We have programs in HIV, in epilepsy, sickle cell disease, cardiovascular disease, uterine fibroids, maternal and child health. We produce hundreds of scholarly work every year. So I think in our own way, we've made an impact both on individuals and communities at large.
Thank you for that question, Dr. Zaki, and the response. Now, talking about the scholarly work that you just mentioned and the impact in multiple countries that the Vanderbilt Institute of Global Health faculty and staff are working in, and maybe students are involved. You said something earlier about a lot of people who do the doctorate of public health, the DRPH, are usually not thinking about going into academic research, but you are in academic research, very deep into it. You apply for a lot of grants to do research in Nigeria and multiple countries. So I'm curious to learn about that trajectory, that transition from okay, there's public health, there's the DRPH, but then there's academic public health, which is different from someone who may go get an MPH and want to work for non-academic public health. So maybe you can share a little bit about that journey, entering that academic public health space and being very successful in it, who help you and so forth and so on.
Well, thank you. Yeah, Dr. Conserve. So my entry into academia started while I was actually in training. When I was doing the Masters in Public Health program at George Washington University, I was in the epidemiology and biostatistics track. And I met a gentleman, Professor Tom Obishasan, who is at Howard University. I met him at a reception. I was introduced to him by Dr. Pati, Mohammed Pati, who's now the Honorable Minister of Health in Nigeria. And Tom Obishasan was, at that time, he was doing research in Alzheimer's disease at Howard University. And so I did an initial 3-month, I can't remember what they call it. It's like an internship during the MPH program. I think it was a practicum. That's what they call it.
Yeah, practicum.
It's been so long ago.
Yes.
Yeah. So I did like a practicum initially with him, and he was a very outstanding researcher, but he was also a physician. He was a physician scientist, or he is a physician scientist. He's still at Howard. He's a vice president there now. Okay. So Tom Vishasan was really the first person who pretty much taught me the ropes there in terms of how do you I had learned how to analyze data because I was in the Epi and Biostats program, but he was the one who really showed me, okay, how do you make sense of the data and how do you present it as a publication? So we had a couple of publications that 1 year. I worked with him for a year before I moved to Birmingham. And then when I moved to Birmingham, I met another colleague, Hamisu Salihu, who heads the Kano Independent Research Center Trust now, and Pauline Jolly, and as I said, STEM Vermont. So with Hamisu Salihu, we published, we had access to this national database, the natality files. That's a database for deliveries in the US. And pretty much we would sit down and think about, okay, what are things that we're interested in looking at? And then we'll run the data and we'll publish the work. So by the time I finished the DRPH, I had close to maybe 30 papers, published papers at that time after a couple of years. And 30 papers. So it was a natural, so it was a natural fit that I would stay in academia. And then STEM Vermont moved from UAB to Vanderbilt to found the Vanderbilt Institute for Global Health. And when he moved to Nashville, at that time, I also had moved to start my residency program at Meharry, so we stayed in touch. And when the opportunity came to apply for the CDC PEPFAR grant in Nigeria, he pulled me in, and I served as the program director for that program from 2008 to 2013. So that program pretty much helped us establish the infrastructure that we needed in Nigeria. It was a $15 million US CDC grant. And that was my first R01 was based off of our observations from that program. We realized that a lot of pregnant women, they would come in for antenatal care, they'll get tested for HIV, and then they'll never show up again. They would just pretty much disappear, drop out. So my first R1 was focused on pretty much implementation science approach to how do we get these women to stay in and get tested for HIV and then show up and stay in care and get treatment and deliver healthy babies. So that was my first R1, and it was embedded within that initial CDC PEPFAR grant. And then from there onwards, it just was just one grant after another. And
Okay.
some 16 years now, things are still going strong. We've over time we've moved. So essentially, what we did was we established a service program, and then we developed the research programs. And then from there, we've now continued to build on that and strengthen our capacity building, our training programs. So we have multiple training grants now in Nigeria as well that are focused on providing building research capacity for physician scientists, for research administrators, for biostatisticians, for ethicists, and so on.
Thank you, Dr. Ali. So I have so many questions, but I'll start with something more recent. You mentioned training programs for individuals in Nigeria. So is it okay for you to share how do people apply for these training programs if they are based in Nigeria?
So thank you. So our training programs are based in at the Amin Kano Teaching Hospital, which is our main partner institution. AKTH, that's the teaching hospital there, is affiliated to Bayero University. So we currently have 3 D43s, 1 R25, and a G11. So the D43 training grants, which are 5-year training grants, one of them is focused on building HIV and NCD, non-communicable disease capacity. So it's focused on physician scientists. So to be eligible, you have to be an assistant professor at the Bayero University, and you have to have an appointment with the School of Medicine, and you have to be a physician. We have the training grant on biostatistics, which is a partnership with Ahmadu Bello University, Zaria, which is where I graduated from medical school, and Bayero University and the teaching hospital. And for that grant, to be eligible, you have to be a PhD student either in statistics or mathematics or computer science, either at ABU or BUK. And you would have to either be a PhD student or have recently completed a PhD program. And with that one, we bring two students every year to Nashville, and they take advanced classes in biostatistics. Pretty much we want to turn them into biostatisticians so that they go back home and they help in pulling together grants and so on. We just recently got funded on a training grant on research ethics. That one we're helping to establish the 3rd master's program in research ethics in Nigeria. The first one in the north, incidentally. And it's going to be at Bayero University, and we'll be training 15 master's students in research ethics. Right now, we're just finishing up the initial needs assessment, and then we'll get the approvals to start the program. So hopefully we should start pretty soon. And that one is pretty broad. The eligibility criteria is pretty broad. Pretty much you just need to show that you have a first bachelor's degree and show evidence that you're actually interested in research ethics. Another one is a research administration training grant. That one is about to end. It's a 3-year grant. It's a G11. And we've used that grant to pretty much strengthen pre and post award grant administration processes. We've trained grant administrators at the teaching hospital in Kano. And then my colleague, Dr. Trevathan, has a training grant on child neurology, where he's training physician scientists to do research in epilepsy and pediatric neurology. That grant is still ongoing. So very, very excited with the training grants because they unlike the research grants that pretty much are directed towards conducting the research, with training grants, you can actually impact people's careers and people's lives. You can use those resources to strengthen the research and the science environment, to improve the science in those countries, and they've been very impactful.
Thank you. Thank you. I couldn't help but to think about the question Dr. Zaki asked about impact and how you pretty much giving, I imagine, more of, a much more comprehensive answer than just thinking about impacting the health systems, access to care, but actually the training that you are able to provide with these different grants, multi-million-dollar grants that you're receiving to have impact on professional development of the people who are working in the healthcare system, so that they can provide better health, services, and have better scientific skills and knowledge to deliver that work. So Dr. Zaki, I'm going to pass it back to you just to find out if you have, any questions for Dr. Aliyu, given that, his last answer is so relevant to what you asked earlier.
Yeah, I mean, I sort of have an idea that popped up into my head because I feel like Dr. Aliyu has been part of designing most of these grants from the ground up, and he has a clear insight of what makes an impact, what's going to be effective. And in my experience, coming up with this, just designing these grants is a huge task. There are a lot of things to consider. And I know it's a broad topic, but what are the things that you mainly consider when designing these grants? What's the thought process that goes behind it? How do you know it's effective before it's even on the ground? It's implemented on the ground. And I know it's a big topic, but just have a thought from Dr. Ali would be nice.
Thank you, Dr. Zaki. So it really is teamwork. It's teamwork. So usually with the way most of our grants tend to be, by the way, NIH, US National Institutes of Health funded grants. A lot of them, especially the training grants, tend to be funded through the Fogarty International Center, which is part of the NIH. And most of the times what happens is there might be like, they call it an RFA, a request for applications, and that is pretty specific. The NIH will pull it out, will push it out and say, okay, hey, we have some funds that are supposed to be for training in HIV, or training in infectious diseases, or training in research ethics, or training in whatever area it is that's of interest at the time to Fogarty, that's a priority to Fogarty. And then there'll be a deadline, and then there's an expectation in terms of how the grant would be formatted or assembled, and the pieces that are needed. So it's really a case of if you're in an academic medical center, for instance, like we are, Vanderbilt University Medical Center, that's how we do the grants. We identify people who would be able to contribute to the work. We identify who the leaders are, the principal investigators. It could be one person, it could be multiple, and then pretty much you pull together a team and then you work on it. So it really is teamwork. It's not a one-person shop. And then we also have the staff that are really important in pulling together the other pieces that are needed, the non-science pieces, this biosketches, the responsible conduct of research documents, and so on, the budget, the financial numbers. So it's a system that for academic centers in the US, the large academic medical centers in the US, it's a system that's already it's a well-oiled machine. If I have, and then the other thing too is, just like I would come across an announcement and reach out to others to partner with me, all the time we get people who come across announcements and then they reach out to us to partner. We've had opportunities to partner with people from multiple institutions, other institutions, and it's really being able to identify the people with the right background and right skills and knowledge who will contribute to implementing the program and getting it done. So pretty much that's what it is. It really is teamwork. It's more than just one person.
That's true. That is very true. I I can relate to that because I'm more, junior in the academic research space, and I'm learning how to write such grants. And I could just share, I got my PhD in 2013. And since then, I've received one NIH grant, which is a training grant. It's called a K99 R00 Pathway to Independence Award. It's 5 years, but that grant is more of a training grant. And then you have to transition from that training grant to getting the R1 that Dr. Aliyu mentioned. And I wanted to just ask you, Dr. Aliyu, a lot of people who may be viewing this may not know what an R1 is, but you mentioned earlier you received your first R1 based on the CDC PEPFAR service program that was established. So I was wondering if you could talk a little bit about what the R1 is and what it means and so forth and so on.
So an R01 is considered pretty much like the golden boy, if I could call it like that, of NIH funding. It's a grant. Usually it's 4 to 5 years. Most of the times, most cases, it's 5 years. It's pretty substantial. At least most of the times it's like 500,000 a year for 5 years. In some instances you can get more funding than that, but pretty much it's the hallmark of research funding. If you have an R01, if you have an R01 grant, pretty much you have the big grant that would help you test your hypothesis, bring out the evidence, and pretty much do great science. Now, before the R01, there are other types of grants, mechanisms like the R21, which are exploratory grants. They tend to be 2-year grants, which you apply for if you do not have any preliminary data and you want to generate the initial preliminary data. And then you have things like the K99 that Dr. Conserve you just mentioned. So really, as an independent investigator, really the R1 is the key thing. An independent investigator who's highly successful, really the evidence comes from the R1s that he or she or they are have. So really it is. Yeah, it is. It's a major accomplishment, and scientists, investigators here are very proud of the number of R1s they have.
Thank you. So can someone like Dr. Ekerin and Dr. Zaki apply for NIH grants? Dr. Zaki is in Ethiopia. Dr. Ekerin is in Nigeria. What would they need to do if they wanted to apply for a training grant for themselves or an R1 level grant at some point, if they are based in Nigeria?
I think that's an excellent question. So Dr. Conserve, as you know, there are eligibility criteria for a lot of these grants. If you're not a U.S. Citizen or a U.S. permanent resident, some of those grants you cannot even apply for them. And then the other thing is, a lot of times they would require, the money goes to institutions. The money does not go to you as an individual. So the U.S. government would require that that your institution is registered, that those registration requirements. A lot of times they will require that you have a PhD, like a terminal qualification, either a PhD or an MD or something similar, a doctoral level terminal training. And then the other thing too is you have to show that what you're doing is innovative, that the science you're doing is significant, that you have a strong research environment, and that you as an investigator, you have the qualifications, the skills, and the knowledge to actually get the work done. So a lot of NIH research grants get reviewed on the basis of those criteria. They will look at, okay, what is the approach? How do you propose to do the study? Is it innovative? You can't just take a study that's already been done and propose to do it all over. That's not acceptable. That's the second thing. And then the third thing, who are the investigators? Who are the people on your team? And then the environment, is it a strong research environment? Those are things that are important, that you just have to have them in place. It's a lot of work, and so you have to know the requirements, know the game. It's probably more advisable to initially partner with someone who has done this before, get some mentoring before you go in for it. Fogarty is increasingly interested in building up the skills of international folks who want to do research and strengthening the research environments internationally. But you have to be aware of those requirements, and you have to have the team that will help you succeed.
Thank you. Thank you. I just remembered there is an actual training grant, a K training grant that individuals who are affiliated with an institution in different African countries or outside of the US can apply for. I think it's a K43 or another K number, but you can find it online. If you are based in Nigeria or Ethiopia or one of these other countries, and you are doing research, you have a strong research environment, and you identify potential mentors, it's kind of the equivalent, I think, of what I received. Dr. Ekerin, you've been listening, taking notes. You heard about the training grants in Nigeria. I'm sure you were taking notes to see if you could apply. What questions do you have for Dr. Aliyu?
Yeah, so I was just thinking that pursuing a doctorate program in a place like the US would often require a bit of navigating a white academic space, predominantly white academic space. So what advice do you have for Black men on finding support networks, navigating those potential instances of bias or discrimination generally in academia? It's just something I'm thinking about because I will be pursuing a PhD soon.
Yeah, I would not. Yeah, I don't think. I think it really is. It's a wide open space. I'll not describe it as a white space. There are opportunities, and in fact, as a person of color, you even have certain advantages, because a lot of institutions like ours are committed to inclusive excellence and having people from diverse backgrounds contribute to the research mission of the institution. So I think the key thing I would say is put your best foot forward. Going into a specialty or a training program, a specialty that you're really interested in, that you have a passion for. Find the right mentor, and then never stop learning, lifelong learning, and then have set goals, be focused, and just do the right thing, and you'll be fine. Issues of racism, of course, those are social issues that do exist, but those are not things that will preclude you as an individual from succeeding in an environment like this one.
Yes, thank you, Dr. Aliyu. I think I would say some of the issues sometimes can even fuel you and motivate you to succeed even more, because there are fewer Black men, and if you have the opportunity to join such an institution, you have a little bit more reasons to continue and look for support. And as far as for looking for support, which is what this platform is designed to provide, the Black Male Professors and Researchers Collective is not based at one institution. So even though you may be pursuing your PhD at one institution, but your support system can be national, it can be international. You shouldn't limit your system of support just to the institution where you are going. And of course, it's good to identify individuals at that institution who can support you. But based on my experience, and maybe others, I've found that it's usually beneficial to identify multiple sources of support, because one person at your institution can help you navigate the courses requirement, the exam, and all those other specific requirements. But then people who may be able to provide opportunities for you after you finish your PhD and so forth and so on are going to be, wide, many. So you want to make sure you're networking staying in touch with individuals. Like Dr. Aliyu said, he stayed in touch with his mentors. And then, they reached out to him when an opportunity came. So staying in touch, networking, issues are always going to be there, whether you're in Nigeria or whether you're in the United States. Issues are going to be there. So, it's not, and you have succeeded in Nigeria, and I imagine you're going to succeed even more anywhere else, because, you've dealt with challenges. Racism is just one of them. So don't think that can stop you by itself. There are several extreme factors, I think, that can, be an issue, but racism is not one that should stop you, or, if you think you might experience it. But I will say, any last questions or comments? I think Dr. Aliyu's word was so, good that I wanted to just stop the interview, but any last questions or comments?
Yes, I actually have one more question, and it's about the journey to becoming a professor. I understand that the journey to becoming a professor can be really long. I would just appreciate if Dr. Aliyu can speak to the resilience and perseverance it requires, basically.
Yeah, you do need to persevere. You do need, resilience is the name of the game, right? Really across the board for academia. If you're going in for a doctorate program, you're not going in for the money for sure, because that's not where the money is. If you're going in for the money, you go to the stock exchange, you go to Wall Street. So you are in there because you believe it's something that's gonna help and impact your community. So yeah, you have to be resilient, you have to be focused, and you have to stay on track. And then, just like Dr. Conserve said, you need to have advisors, mentors who will help you along the way, both whether it's in a professional or in a personal arena. It's important to have that guidance. The people who succeed, in my experience, the people who really succeed in academia are people who are good at networking, people who are good in asking for help, people who are good in realizing these are their strengths and these are their weaknesses, and developing a plan to, every one of us has strengths and weaknesses, but then you develop a way by which you can improve, reduce your weaknesses and improve your strengths. And being able to know that and acknowledge that is important. And then at the same time, you have to have time for yourself as well. Have time for wellness and personal well-being. So yeah, definitely. That's how it goes. And it's doable. It's doable. Doctorate degrees they're there for the taking, but you just have to work hard towards getting there.
I love it. I love it. They're like fruits hanging from an apple. But not easy to get. But thank you very much, Dr. Aliyu, for making the time. I really appreciate it and have learned a lot from the interview. And I hope our listeners who are watching this will find this, beneficial, and subscribes to the channel or share it with others who may find this interview very helpful. So I'll say goodbye, and thank you very much for the time.